Hi, I'm Congresswoman Jan Schakowsky.
And I'm Congresswoman Doris Matsui. We're the co-chairs of the Congressional Task Force on Seniors.
This week, the Republican majority attempted, for the 33rd time, to repeal the Affordable Care Act, or as I proudly call it, Obamacare, even though the Supreme Court of the United States has ruled it constitutional.
There is a lot of false information floating around about the Affordable Care Act, so we wanted to take a moment to set the record straight. The health care law is a major step forward in providing affordable, quality care to all, and repealing it would be a massive step backwards for millions of seniors.
If you are over 50 but not yet eligible for Medicare, you would be back at the mercy of private insurance companies. They could deny you coverage if you have a pre-existing condition, drop coverage if you get sick, reinstitute lifetime limits on coverage, and implement double-digit premium increases, or just refuse to cover you.
The Republicans like to say that the Affordable Care Act cut $500 billion from Medicare. The truth is, the health care law strengthens Medicare. It does not make any cuts to seniors' guaranteed benefits. What it does is cut wasteful spending, such as taxpayer handouts to insurance companies. These companies have plenty of their own money. They don't need extra help from taxpayers.
If the Affordable Care Act is repealed, seniors who fall into Medicare Part D coverage gap, the so-called donut hole, will immediately face higher prescription drug costs.
However, thanks to the health care law, over $3.2 billion has been saved on prescription drug costs, with individuals saving on average $635. And as the health care law continues to be implemented and the donut hole is completely closed, Medicare beneficiaries will continue seeing savings. By 2021, the average Medicare enrollee will save nearly $4,200, and people with high drug costs could save as much as $16,000 in that time.
Obamacare also provides free preventive services like cancer screenings and diabetes tests, and it has saved over $5 billion through new fraud-fighting tools. All these would be lost with repeal.
Clearly, the Affordable Care Act is providing and will continue to provide major benefits to seniors. And what about the Republican majority's health care plan? They don't have one. They want to repeal the Affordable Care Act and offer nothing in its place.
Unfortunately, the push to take away Obamacare's many benefits isn't terribly surprising from those who are also lining up behind the Republican-backed Ryan budget, which quite simply makes the wrong choices for our country by favoring the wealthiest and big oil over America's seniors, middle-class families, and jobs.
The Republican-backed Ryan plan would end Medicare as we know it, privatize it, and leave you on your own to deal with the insurance companies. It would simply shift costs to seniors, eventually doubling your costs. It will make it harder for you to choose your own doctor and raise your costs for preventive care and prescription drugs.
Cutting benefits and raising costs to seniors is not the answer we support. And groups from AARP to the National Committee to Preserve Social Security and Medicare to the Older Women's League agree. We will continue fighting to ensure that does not happen and keep working to protect the millions of seniors who would be hurt by the Republican-backed Ryan budget and the repeal of Obamacare.
Thank you for listening. I hope you found this information informative and helpful.
For more information like this and on the Congressional Task Force on Seniors, please visit our website at dems.gov/seniors.